Hello, this is Dr. Hema, the founder of CSASmartGroup.com. I'm so delighted to be here after so many months, and thank you for watching this video. I'm so excited because I'm doing this Google Hangout for the first time, and we have got all the setup, like proper camera, mic, and lights. It's amazing. It's like a studio set, right? And it's a huge thing for me to step up, right? Okay, so who am I? I'm Dr. Hema, one of the general practitioners in UK, and I train junior doctors, medical students to rock their consultation with confidence and ease and pass their exams in flying colors, right? Why we are here? I'm here to share some of my tips and structured approach to cases, particularly dealing with sexual health. It's very tough for all of us. If we don't practice these questions, it looks very odd when we ask those questions with the patients, and patients don't feel comfortable at all to share their secrets. And if we don't address it properly, we can miss it, and then there is a lot of scope for getting compliance, medical negligence, everything. You know what I mean? So these are the important cases we have to prepare well, because we will see them in and out every day, almost every day. And most particularly, they will have similar cases in examinations, just to check your communication, your ability to get the relevant information from the patients. Okay, so let's dive in. The general tips. The most important one is, please ensure privacy, and always address the confidentiality issue, and let the patient know that we always respect that confidentiality unless it is harmful to them or to others, right? And try to be professional all the time and have a open-minded, right? And be open-minded. It's always important. Don't try to be judgmental, and have a frank approach. That is the main key. And always take measures to put your patients at ease. It's very vital in very sensitive cases like this, particularly when we are addressing the sexual history questions and relevant information and the examination. It is really vital to put the patients at ease. And remember, a shy doctor begets a shy patient. So it's very vital to address your body language and your gestures, right? And adopt an open posture, and be calm and collect, right? If you feel at ease, the patients will able to read your energy, and then they will feel more comfortable and ease, and then they divulge all the informations you need, and echo their body language and maintain good eye contact, and always explain why asking sexual history is relevant in their case, and keep your questions focused and very relevant, and pick up on subtle nonverbal cues from the patients and address them then and there. Always try to promote risk reduction and good sexual health education. And always consider child protection issues, and refer to the relevant child protection or on-call team, even if you're in doubt, right? It is everybody's responsibility to do that. And consider safeguarding issues in vulnerable adults too. And always manage victims of sexual assault with sensitive and very considered approach. Okay, these are my general tips how to address a case with sexual health background. Now, these are the example structured approach. Feel free to change the words you're comfortable with. I would always start with, I will build the rapport, I will make them feel at ease, and I will try to ensure the confidentiality and try to be non-judgmental and encourage the patient to share what they feel, to share their concerns, to share their history. So the very first question I would ask, like, when did you last have sex or sexual intercourse? As STIs have incubation and window period, right? And then I would ask, like, was it with a man or a woman? For example, TV is very common in women and LGB in MSM. And Then I would ask, was the person a casual or regular partner? Because the risk varies with the exposure rate. The fourth question I would ask, where was the partner from and what is their ethnicity? As you know, Afro-Caribbean and Mexican races have higher risk. In which country did you have the sex? Because countries like Thailand, Africa, Mexico have higher risk of STIs. I would ask, like, what kind of sex did you have? Because it guides me which test I should order, like examples like swabs, blood tests, etc. And for each kind of sex, I would ask, like, whether it is oral, vaginal, or anal, and whether they use a condom. And for heterosexual sex, I would ask, like, was there any contraception used? And always relate to risk of pregnancy when asking about last menstrual history period in gynecological history. Very vital information to cover, and offer any termination advices if it's a case of rape or unplanned pregnancy. Assess whether they were the active insertive partner or passive receptive partner as appropriate. And ask whether their partner had any symptoms at the time. And when did you last have sex with someone different? Now we have to go from question one all the way. You know what I mean? With each partner, we should be very specific with those questions and get very detailed answer. And my tip is never assume the sex of previous partners. For men who report recent sexual activity with women, it might be useful to ask if they ever had sex with men in the past. Have you ever had any previous STIs? This is very vital to get information about the test they had, any drug allergy, any drug resistance to the infections, etc. Have you ever had a sexual health checkup before? And this is also very vital so that we can get the relevant information from the past notes. Have any of your sexual partners ever injected drugs or shared needles? The drug misuse history is very vital because it increases the risk of transmitted infections. For women, have you ever had sex with a gay or bisexual man? For men, ask about any history of sex with men as per point 9. And ask about whether they have had any HIV, hepatitis, syphilis test before, and assess the risk and offer test as appropriate. And ask them whether they have been vaccinated against hepatitis B or have you ever had hepatitis, right? And assess risk and offer vaccination if appropriate. Right, friends, these are the general tips and structured example questions. Please feel free to change it as you feel comfortable. And the most important thing is you have to practice these questions with your friends and colleagues, especially with senior colleagues who have more experience in sexual health cases, right? And this is very important to be like a win-win situation. You can offer your best service to the patients, and patients would thank you forever, right? And to get more thank you letters and decrease your compliance letter. So all the best if you're preparing for your exams, and keep connected and visit www.csasmartgroup.com to get more information and more teachings like this. And always feel free to comment below with your questions, with your worries, concerns about your exams, etc. I will try to cover in the next topic. Okay, bye bye, see you.